So how can I mitigate the annual 15% or more increase that your health insurance broker brings each year? That's a question a lot of people have, isn't it? Because really in America, this is a question that doesn't get asked enough because we've really been conditioned to the fact that this is just the norm. And have you ever stopped and thought about that? Because I stop and think about that a lot. When Forbes approached me, Forbes Books, about writing a book on healthcare affordability for corporations, one of the things they asked me is if my family was able to afford healthcare, and it really got me thinking that even though I was blessed and fortunate enough to be a hospital CEO for almost 10 years, there was a gap in there where I was unemployed for 6 months, and the COBRA policy that was offered to me was almost $2,000 a month. My wife and I made a calculated decision to not purchase healthcare insurance, and we had 3 children that were in middle school at the time. But it really gets me thinking when I think about that 6 month instance. If I am somebody who's been fortunate enough to have a college education, a graduate degree, and climb the corporate ladder, be a CEO for, gosh, I've been a CEO for 7 years, making 6 figures. I was totally blessed. I'm out of work temporarily for 6 months, and I can't afford health care for my family. That's an epidemic. That's a problem in our country because if I can't afford it, somebody who's been afforded all those luxuries, whether they were handed to me or I worked hard for them, it doesn't matter. Somebody who's been afforded those opportunities can't afford basic access to healthcare services. What about the rest of the folks that haven't been blessed enough to have those opportunities yet? And hopefully they'll come sometime in their life. But that's just a question that sticks with me, and I think it's really important to ask. But here's the question that I think every corporation and company should ask, and every family should ask themselves: is healthcare bankrupting your business? I can almost guarantee you the answer is yes if you haven't adopted consumer-driven healthcare. And is healthcare bankrupting your family? I know very few families who would say no to that question. So now that you have those 2 questions in mind, I have one more question for you. If you are the individual who is responsible for spending on healthcare at your company, at what point are you, the person who's responsible for your company's spending on healthcare, going to declare the tipping point? The tipping point to which you'll say we cannot continue to have that 15% increase each year because it's breaking our business. And what's interesting? I'll close this comment with this thought. When I ask people that around the country as I travel and speak, I'm a professional public speaker. I speak at events all over the country. And even though people best know me for my humor and storytelling, it's these tips on healthcare spending savings that they really appreciate when I leave. But what really blows me away is when I say to them, hey, when are you going to declare the tipping point on when healthcare is costing your company too much that it's going to break you? And you know what they all say? They say, we already passed the tipping point. And I kind of step back and I pause for a minute and let the silence soak in and say, but you haven't. Because the definition of a tipping point is when you declare that we won't do that behavior anymore. We won't behave in that manner, meaning we're not going to accept a 15% increase for less services. That's what healthcare has become in America. And until we say no, it's going to continue to be that way.